Hey everyone, listen, in this video, I want to give you a basic understanding. Really, this video is going to help you understand how Medicare Advantage plans work, and then also going to give you a basic understanding of like how you can manage your healthcare with a Medicare Advantage plan, the cost of it. So tune in and get prepared to learn. My name is Kevin Stevens. I'm the owner of KS Insurance Advisors, and I'm making this video primarily to educate you. So if you are looking to get more education, you can visit our site at ksinsuranceadvisors.com, or you can call our office. The number and all the contact information is on that website as well. Now, let's go ahead and dive into how Medicare Advantage plans actually work. First off, the reason why I put Medicare replacement plans is because primarily what a Medicare Advantage plan is going to do. Remember, when you have original Medicare, the red, white, and blue card, when you have original Medicare, that's going to be your primary coverage. But when you decide to choose a Medicare Advantage plan, that Medicare Advantage plan then becomes your primary coverage and is going to dictate how you transition and use your health care. So, for example, let's say you have original Medicare and you only have the red, white, and blue card. Let's just say, for example purposes, you chose Company X for your Medicare Advantage plan. Company X is now going to be your primary health insurance coverage, and they're going to dictate your copays, the cost of all your different services, and the original Medicare card takes a backseat. You are no longer going to use that or show that at all. When you go to your doctor, when you pick up medications, none of those things. Okay? So when you choose a Medicare Advantage plan, typically we like to call it a Medicare replacement plan because it's going to replace your original Medicare card. Now, here, when we first start off here, if you look at maximum out of pocket, what is a maximum out of pocket? Well, each Medicare Advantage plan has what's called a maximum out of pocket. And to put it as simple as you need is a maximum out of pocket is simply the amount of money that you are going to be responsible for in a calendar year. So for example purposes, let's just say you sign up with Company X and their max out of pocket is $5,000. God forbid, of course, if something happened like you got cancer or you got diagnosed with some type of heart condition and you had to have all these different type of surgeries and scans and all these different things, you're probably going to meet your max out of pocket. Okay. And what that means is you're going to have to spend about $5,000 in that calendar year. And then once you reach your max out of pocket, you are no longer responsible for any more costs. So the maximum out of pocket right here is just simply the maximum amount that you can spend in a calendar year. Think of it that way. Your MOOP is your maximum amount that you could spend in a calendar year. Okay. And you always want to be aware of this number when you're making a decision on your Medicare Advantage plan, because it's going to determine how much risk you have moving forward throughout the year. Okay. Secondly, when you look at Medicare Advantage plans, if you were to just scroll through your summary of benefits, each Medicare Advantage plan has a summary of benefits. And when you choose, let's just say, for example purposes, again, you chose Plan X, right? The Medicare Advantage Company X, you're going to have copays for each service that you use because a Medicare Advantage plan has a pay-as-you-go structure. Okay, it has a pay-as-you-go structure. So let's break that down. To your primary care doctor, it's going to be $0. And this is already negotiated by the insurance company of your choice. So if you go with Company X, right, they have already negotiated with your doctors, with the hospitals on what you're going to pay for those particular services. You will have a copay for each and every service. So whether you get a scan or an MRI, you're going to have a copay. Whether you go to your primary care doctor, that copay may be $0 for example purposes. If you go to a specialist, so any doctor that is not your primary care doctor, that cost may be $30. All those different copays are going to contribute to what's called this number here, your max out of pocket. So again, once you reach that max out of pocket, you're no longer responsible for any cost. The insurance company covers 100% of it, right? But you have to reach that max out of pocket first. So the copays are just going to be the fixed amount that you are required to pay for each particular service. So if you don't use any services, let's just say you're healthy and you don't go to your doctor or you don't get any scans or MRIs, then maybe a Medicare Advantage plan is a good option for you because you're not using the services. So you're not going to pay anything when it comes to using your plan on a monthly basis. You're not going to spend any money because you're only required to pay your Part B premium, right? And your Part B premium is going to change on a year-to-year basis. But for example purposes, okay, if we're talking about 2025 as of right now, $185 is what you'll be responsible for. Most people are going to be responsible for a Medicare Advantage Part B premium. And then you're going to pay your co-pays as you go along, which is the fixed amount that is negotiated for each service that you're using. Okay, and all those co-pays contribute to your max out of pocket. Okay. Moving on, with a Medicare Advantage plan, you're going to get additional benefits. So this is the thing that is widely marketed to you, that you're going to see on TV commercials, on mail. These Medicare Advantage Part C plans come with additional benefits such as dental, vision, hearing benefits. So you don't have to buy them a la carte, right? They're going to come built into your plan. Some Medicare Advantage plans actually come with what's called dental coverage built into it. Which they come with drug coverage built into it. Most Medicare Advantage plans will come with your drug coverage built into it, right? So your Part D will actually be included. So you'll get your hospital, your medical, which is Part B. You'll get Part C, which is all the additional benefits. And then Part D, you'll have your drug coverage built into your Medicare Advantage plan. So for simplicity's sake, if you choose a Medicare Advantage plan, most likely it's going to cover your medications as well. And then you also have, with Medicare Advantage plans, it's a pay-as-you-go structure. So as I mentioned previously, you are going to have a copay for each and every service. Whether you go to your doctor, whether you go to your specialist, whether you get an MRI, whether you stay in the hospital. So if you're an inpatient, if you stay in the hospital with a Medicare Advantage plan, you're going to be required to pay a copay up to a certain amount of days. So let's just say, for example purposes, you choose company X. You're going to have a copay for the first 5 days that may be around $200 or $300. And then after that fifth day, you're no longer responsible. The insurance company, your Medicare Advantage plan, is going to cover the rest. Okay? So you're going to have co-pays and you're going to pay as you go. And then lastly, you have Part C, which is what a Medicare Advantage plan is called. So Part C plans, as we like to call them, Medicare replacement plans, are going to give you all those services in one plan. And primarily, we like these plans because they break down every different part of Medicare and they give you all the things you need. But you got to be mindful of your max out of pocket, and you have to be mindful of the co-pays going into these plans before you're making your decision.